Hi.
Hi.
Welcome back.
Thank you.
So we had one visit. Tell me what happened. Or how did you do from the first visit?
I did pretty good actually. The second day I felt so energetic. I had so much high energy.
Okay.
Like I feel open. I could breathe better. Because I always had a struggle with the left side, like breathing, and I had shallow breathing. So
Okay.
it kind of helped me more to breathe more. So I've been doing breathing exercise.
So the breath is a little bit better.
Mm-hmm.
Yeah. How about the rest of the body?
The body, I felt just like when somebody got smashed on the skin, but I didn't
Sore?
feel it. Sore.
Sore?
Yeah.
Spicy sore?
Mm-hmm.
Okay.
Yeah,
So-
that's it. Yeah, and then tense on the back.
Okay.
That's all.
How
Yeah.
did you sleep?
Good. I always sleep good.
You always sleep
Mhm.
good? Okay.
Yeah.
Anything different?
Different. No, not really.
Okay.
I mean, I feel good.
Okay.
Yeah.
So energy is better?
Energy is
Movement's
better.
a little bit better?
Yes, I feel walking more balanced. I feel like.
Okay. Did you do yoga?
No, not. I haven't done yet.
Okay, good.
I was gonna do the cartwheel, but I was gonna ask you first.
Just give the week. Just
Uh-huh.
lots of walking and swimming and biking and things like that, just for the week.
I was
Okay.
gonna use the rolling the ball, so.
The yoga
Back
ball?
bends.
You
Yeah.
can do that. You can
Oh,
do back
okay.
bends, you can do all that stuff.
Oh, okay.
Another really, really good exercise for the spine, because 90% of the nutrition in the brain comes from movement in the spine.
Mm-hmm.
So if spine is stuck somewhere, we're not getting 100% movement.
Mhm.
And a very easy thing to do is to just sit on a yoga ball. So just sit on a yoga ball, put the curve in the back, and you just bounce up and down. And you do that for 5 minutes a day, and it's a fantastic way to get motion in the spine.
Oh, okay.
And it's a little bit harder than it sounds.
Mm.
You know, a minute, 2 minutes in, you start bouncing, and you feel it.
Yes.
Okay, but it's a very simple way.
Okay, that's good.
Now, you have any questions for me?
Yeah, only on the X-ray. Because last time I heard that you said there's a little misleading, and so I was noticed that I don't know if the skeleton was on the facing, because anatomical position, the right that it is should be left.
Okay, no. When in chiropractic, it's a good question. So whenever we're looking at the spine, right is right, left is left. It's as if we're looking at the patient from behind.
Oh, okay.
So that's one difference. So yeah, we were looking behind. Right is right, left is left.
Oh, yeah, because
Does
in
that make
medical we learned that this is the left, this is the
Correct. So anatomically, if you're doing something, it would be the opposite way.
Yes.
So you know that the curve is slightly to the right and it slightly bends to that right side. Yes?
Okay.
Okay.
All right. Good.
Any-
I'm glad you clarified that.
Any other questions?
No. Just the. I don't know if you're gonna continue working on the job, because it's better. Like the click is not like you used to, and I feel sore right here on both sides. I was like, that is good.
Okay.
But then when I open my mouth and then I put my fingers, when I feel the click, like I don't
Is
hear
it-
like a big sound
So
anymore.
it's different.
It's different.
And that's what you actually came for, your
Yeah,
TMJ.
Yes.
Okay.
Yeah, that's
Okay.
one of the things. That's the most important one.
Okay, can I see you walk first?
Okay.
So in her walk, we still got the wiggle, but there's little more movement now in that left pelvis. So we still have this, and I don't expect it to go in one visit,
Yeah.
but you can see the scorpion is, it's going this way, but it is moving up and down a little bit too if you look
It's more
at
like a crab right now.
It's like a crab right now. All right, young lady, come over here and have a seat, please, and let's continue. Starting here at the base of the neck, let's see what we find. So we did C1 as an ASR, which means it was a right atlas. And today we have still about 5 points there, okay? 5 points there. You understand my process, ma'am? You understand everything I went over that first visit in terms of how we're working on the body?
Yes, I am. Little by little, I am.
And you know at any time you can ask questions, right?
Yes. Thank you.
Cool. That's all clear. Let's check the low back. Alrighty. Well, it looks like we're going to continue on with your S5 and C1 now. 5 points and 5 points, right at the tail.
Still on the tail.
Yes, ma'am, we're not here yet. Okay, scoot forward, please. Feet together. Open and close the knees. Let's check the thumbs, see how the movement is. Good. Left side only. Good. Right side only. Pelvis is good right now. Scoot back for me, please. Now, let's go back into extension. That's L5. L5. S1. S2. Good. S3. S4. S5. Still better than the first day. There's movement. When I push in here, Raina, is there anything shooting into the hips or the glutes?
Shooting into the leg.
Left side, right side?
Left side.
When I push on this one or this one?
That one.
This one.
Yes.
Okay. One more time. Let's see. That's 5. That's 4.
Okay.
5.
5 is more. 4 is okay.
Okay. So we're going to continue on 5. Right atlas. And then we'll tune up the rest.
Okay.
And we'll work on jaw, nose. Maybe I'll find something new to crack today.
You're gonna have a nose job?
You're gonna get your nose job today.
Oh, wow.
You ready for it?
Oh yeah, I hope so.
Okay, madame. So we're gonna do C1. We'll do it in the chair. We'll do S5 over here. We'll have you walk back and forth, and then we'll recheck.
Okay.
Sit back all the way, please. Right hand up. Let's put the seatbelt on. See, the purpose of the seatbelt, people ask, right? It's to stabilize the upper thoracic spine. It makes things more stable. It makes it easier to adjust. Yeah. Another question people have been asking is about these gowns, right? You know that? They're like, why the heck does Dr. Rahim use a hospital gown to examine a patient? Well, that's what Dr. Gonstead did. And I want to just talk about that for just a quick second, if you don't mind. So I just wanted to talk briefly because I get a lot of comments. Why does Dr. Rahim use a hospital gown to adjust? And you don't see a lot of people doing that, right?
Yeah.
People normally adjust through clothes or whatever they're wearing, or yoga pants or something like that. Dr. Gonstead, in his evaluation, so you were asking me who is Dr. Gonstead. I'm not Dr. Gonstead. I'm a Gonstead chiropractor. Dr. Gonstead was a chiropractor who practiced for 55 years in Mount Horeb, Wisconsin. They called him the Miracle Man. And where everyone else failed, this guy had a solution. And his whole philosophy was always suspect a neuritis first. Meaning what? His philosophy, as with most principle-based chiropractors, every sick person has nerve pressure somewhere in the body. Body is designed to be in balance with nature. We talked about that, right? If there are misalignments in the spine, that can cause nerve irritation. Wherever that nerve goes, there's less function. So what does that mean? It means that there's diminished function. Diminished function can lead to malfunction. Malfunction produces a symptom. A symptom is labeled as a disease. So we're not here trying to chase all these symptoms, right? Now, let's get back to the hospital gown. He gowned everybody. This is a skin-on-skin contact. This is a very, very specific adjustment. You've been adjusted before? Maybe you can share what was the difference in the adjustment for you. Was it different for you in terms of receiving that adjustment?
From a different chiropractor?
Yeah, it's a very, what we're doing here, it's a very precise adjustment. So the vector that we're applying, the force, it's a 3-dimensional adjustment. It's not just do this. Now, to really feel that, right, to feel that, it's skin on skin. It's skin on skin. You got to push tissue out of the way. He was a big advocate. Get on that bone, right on that contact. Because if you got too much muscle and tissue in the way, it hurts. Okay, and you see, so number one is we want to be able to see and examine the whole spine. We want to see the tissues. We want to see the contour changes. We're doing static palpation. Static palpation is one of the most important examination tools that we have. Is we need to see and feel the swelling, the edema, the redness. How do you see that when you're wearing the clothes? It doesn't make sense to me. So this work, it takes a little longer. And that's okay. Even when you're practicing and starting this stuff, it takes a lot to get to it. Once you get there, there's no going back at that point, okay? Because for me, it's certainty. I need to know I'm on that bone. And I don't want any wiggle or any slip of that. Does that make sense?
Yes.
Okay.
I think the more senses you can use with the patient, the better it is.
Exactly.
Like seeing, touching, and hearing.
Exactly. You ready?
Ready?
So those right hand up. Now we're going to do an ASR atlas. We're putting the stabilization strap on. Excellent. Shoulders down, palms up, facing that way. And we're going to be just right here, ASR. Anterior portion of the atlas. And we want to just be nice and easy there, ASR. And that's a home run. Nice and clean.
Okay, nice and clean. Nice for you.
Did we have light today?
Yes, yes. It's different color though.
What color was it?
It's more like pink.
Okay, not orange anymore.
No, it's pink.
Okay.
Yeah.
Let's come over here and let's get that root chakra going. S5, the scorpion sting.
Now I know what I'm coming to.
What's that?
Now it's no surprises.
There's no surprises, ma'am, and the worst is over, okay?
You think so?
I know so. Well, it's all relative, I guess.
Me asusta, pero me gusta.
¿Qué?
Me asusta, pero me gusta.
Bueno. Respire. Sáquelo. Respire. Sáquelo. Respire. Sáquelo. Bueno, otra vez. Perfecto. That's the home run, lady.
Okay. That wasn't that bad.
It wasn't as bad today.
No.
And let's walk it off a couple of times.
Okay.
Different again.
Yeah.
Good. Have a seat over here. Let's re-scope you. Let's test the meter and see, starting at the base of the neck. C1 is clear. Mid-back is still good. Nothing shifted there. And the scorpion. The scorpion's behaving today. All clear. Very nice. Back slowly towards me, please. 5. S1. S2. S3. S4. S5.
3 and 4 just for a little bit. Just a little, tiny.
Now what'll happen as we're doing that, things will obviously be shifting around, yeah? So
Yes.
icing is going to be the most important thing.
Okay.
All right, let's take a look at your jaw. Okay, slowly open. Slowly close. Slowly open. It is doing better, ma'am. Nice. Open and close. So we will continue on the right. And we're going to do the septum on the left side. Let's go ahead and start with the TMJ first. Using the condyle block to stabilize the cervical spine. Go ahead and slowly open. We're doing a right AI. Open, open. Open all the way. There we go. And slowly close. There. Good. Woo! Look up. No, look up. Slowly open. Bueno. Open all the way. Close. That was my wrist. There you go. Oh, now let's use the little buff and polish on the side. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1.
That ever feels good.
Nice. Sit up straight for me, please. And ears.
Oh.
Nice.
Okay, I know what that is.
Let's go on your back here. I need to do your nose. I have your permission?
You have my permission.
Thank you. Chin down. We're doing the left deviated septum. Breathe through your mouth, ma'am. I'm bringing the nose over and setting like that.
Okay.
Good. Gotcha. That was it.
That's it?
That's it.
Oh, wow.
Take a nice deep breath in and out. Deep breath in. Khalas. Very nice.
More open.
More open, right? Good. Awesome. Over here, ma'am, now we're going to work on your ankle. Slide down a little bit so your ankles are hanging just off the edge of the table, please. Awesome. Bring your feet together. Bring your toes back as far as you can. That's actually better, ma'am. Well, bring them back. Yeah, we still got a little bit here on this side. But the difference is a lot less now. You'll see the difference when you compare. Even in the video, it's different. And the thing you should be feeling more is when we have proper dorsiflexion here at the ankle, we have a better toe off. If we're stuck AS like this, anterior superior, then the toes and the midfoot become hypermobile. And over time we get these, this is where this is coming from.
Oh, yeah?
Yes.
Because I wear out my shoes on my toe, kind of.
Now, there's another good way when you're wearing shoes for the right size. So, the way you know if the shoe is the right fit or not, just take your shoe, bend like this. Watch. You bend like this. The big toe should be at or slightly behind. It should never be in front of that crease. Otherwise, that shoe is too small. You're going to get foot problems.
Okay.
You hear that, everybody? Very simple way to make sure your shoes aren't small for you. Just bend the foot. Bend like this. You got the crease right there. The big toe or the bunion, this part right here, should be at or slightly behind. If it's in front, shoe is too small.
Good to know.
Yeah. I'll be doing a video on shoes very soon.
Okay.
And we're going to be comparing athletic and luxury brand shoes. It's not about how expensive they are. It's how do you pick the right shoe. And you know, there's a couple of things people don't realize how shoes are made. And we'll be talking about that very soon.
That's interesting.
5, 4, 3, 2, 1. Passive range of motion. 5, 4, 3, 2. Passive. Let doctor do it, please. 1, 2, 3,
That's
4.
what passive means.
Passive means patient doesn't help. Okay, madam.
Passive. The other one is active.
Yes.
Okay.
All right. Let's come over here and get a nice little set. So when we're setting a talus, very simple, long axis. Is it a long axis distraction where we're yanking the whole leg? No. We're going very specifically at the talus. So we're on the dome of the talus, index, chiro index on the medial aspect, dorsiflex, dorsiflex up, thumb is pushing, fingers are pulling. Superimpose the fingers. Now we're going into dorsiflexion and slight inversion. This is, eversion. So dorsiflex, evert, and set. And that's the home run. Very nice. That was the ankle. Talus, AS talus, medial tilt. Go ahead and walk now. Now from all of that, we did C1, we did S5, and we did the talus. Okay? Along with the jaw and the septum. Walk on your toes, please. Walk on your heels, please. Is it worth the drive?
Yes.
Yeah.
Yes, it is.
I appreciate your question last time and comment. I really do.
Sure.
And let's see where this goes. And
Okay.
I know, like I said, is once we get S5 stabilized, then we'll move up. And for you right now, lots and lots and lots of walking.
Lots of walking.
Okay, you're a yoga instructor, you said? You're familiar with Kapalabhati?
Kapalabhati?
Kapalabhati
Yes.
yoga?
Oh, no, the breathing.
Yeah, I'd like you to start that today.
Yeah?
Yeah, just 10-15 minutes a day.
Okay.
Okay?
Sounds good.
And we'll talk more about it next visit as well. And I'd like to know more about your style of yoga.
Okay.
Okay?
All right, sounds good.
Squeeze
I'll
my
tell you
hand.
more about it.
Squeeze.
I was gonna ask you last time. I squeeze hard because I'm strong. I
Squeeze.
think. So I don't know how strong you want me to squeeze.
Well, what I'm feeling, I'm not feeling your strength.
No?
I'm feeling that all the bones are in alignment. It's
Oh.
something I do. People are
Oh.
wondering, what is this guy doing? He's
Yeah.
shaking hands.
Yeah.
Well, there's 10 carpal bones here, right? So there are joints in the wrist, joints in the elbow, all the way up to the shoulder.
Oh, that's what you're feeling.
Yeah, so
Okay.
these are the pulleys. These are the cables.
Mhm.
If the pulley is out of alignment, cable don't work right. So I'm just feeling to make sure all the pulleys are where they're supposed to be.
Okay.
Squeeze.
Mm-hmm.
So when you do that, you're loose on the inside here.
Uh-huh.
Relax there.
Okay.
And distal ulna. Good.
Okay.
Squeeze. Different.
Yeah.
Now, last piece, scaphoid. Good. No crunchy. Go like that 5 times. 1, 2, 3, 4. Squeeze. Good. Squeeze. On this one, we have scaphoid. So
Uh-huh.
this is all firm. It's loose here.
Mm.
Relax there. Almost. There. Squeeze. Poquito más. Radial head. There it is. Squeeze. Good. Squeeze. So now they're firm. They're seated. I don't feel
see.
anything loose there.
Okay.
That's what I'm doing with them.
Okay.
Okay?
I'm gonna ask. I didn't know what that was about. And probably people want to know too. What is this shaking about?
Because they think I just squeeze a hand and I just start popping and cracking.
Yeah.
I'm being very specific in what I'm adjusting based on what I'm feeling.
Yeah.
Okay?
Yeah, you said that. I feel it too. Like when I squeeze you, I feel like when I'm strong or when I'm weak.
You feel it, right?
Yes,
So
yes.
you'll start to notice it as you're squeezing and
Yeah.
shaking people's hands.
I'm gonna start doing that.
Okay, my
Yeah.
dear.
And I'm gonna start popping their bones. Just kidding.
No joking, my friend. You have a wonderful day.
Thank
Okay?
you, you too.
God
Thank you
bless
so
you.
much.
You
All right,
take
you
care.
too.